Hi, I'm Susan Taylor with Scripps Health in San Diego, California. You are a new parent, and there is so much to learn. Keeping your baby healthy is front and center. Joining us to talk about common infant illnesses is Dr. Henna Park. She's a pediatrician with the Scripps Coastal Medical Group in Carlsbad, California. Dr. Park, thanks so much for being with us.
Thanks for having me.
So, why are infants prone to getting sick? What makes them vulnerable?
Yeah, so our immune systems are incredibly smart and complex. And as it encounters viruses and bacteria, it does learn to identify it the next time and become more efficient at fighting it. Our infants do have the machinery to do that, but it does take time for it to mature because it needs that learning process. So this can take at least a couple of years.
So let's talk about respiratory infections caused by viruses. What are the common ones? What are the symptoms and the treatment?
Yep. So there are at least 200 different viruses that we know cause common symptoms of the cold. So ones that you may hear about in kids are the rhinovirus, which refers to the nose, the RSV, which is we're currently in the season currently, influenza, and of course, recently COVID-19. So typically symptoms are fairly similar amongst them. So we see fevers, cough, congestion, sneezing, occasionally some low appetite and low energy. In your younger babies, you may notice that they're fussier than usual, not feeding as well, so taking lower volumes, or for your nursing babies, unlatching more often during the sessions. And in these cases, treatment is supportive. So unfortunately, we don't have any antibiotics to target viruses, but it's providing symptom relief as they get through the infection. So in terms of fevers, if your child is over 6 months of age, you can alternate between Tylenol and Motrin. For those under 6 months, just sticking to Tylenol because Motrin can't be processed as well by the kidneys at that age. And we worry about things like kidney damage in the temporary or long term. For cough and congestion, humidifiers help moisten the air, which can help break up mucus, reduce the congestion in the nasal passage. Warm, steamy baths, especially at nighttime, to release that mucus before they go to bed. Nasal saline and suctioning to really help bring out the secretions afterwards.
So when you talk about RSV, there is a vaccine for that. Is it okay for somebody under the age of 6 months to get that?
There is. So there is one available for under the age of 6 months. So please do speak with your physician about that.
And then what about whooping cough?
Yep. So whooping cough is also a respiratory illness, but in this case, it is caused by a bacteria called Bordetella pertussis. And it does, like a common cold, cause cough, congestion for the first couple of weeks, but can last much longer, so up to a couple of months. So if you do suspect it or your physician does, there is a test to detect the bacteria. And along with supportive care, it may be recommended that you start antibiotics.
And then what about diaper rash? Because you got to change the baby's diaper a lot.
Yeah, so that is very common. So there are two common types. One is called irritant dermatitis, typically from contact with the stool. So we recommend frequent diaper changes just to reduce the time of contact between the stool and your baby's skin. Warm rinses, trying to avoid soap because that can be a little bit irritating as the skin's trying to heal. And if you find that the rash is still lasting for over 3 days, especially up to about a week after trying home care, that would be a good time to check in with your pediatrician. So there are some yeast infections that can present similarly and progress over the next couple of weeks.
So how do you clean the baby's skin if soap is not the answer?
Of course. So we recommend sticking with warm water rinses. And after you clean your baby's bottom, applying a barrier cream to protect the skin from the surface of the diaper itself. So that can be any emollient or a barrier cream that contains zinc oxide. So that's something you can ask your pediatrician about as far as recommendations as well.
And then what about ear infections?
Yes, so they typically follow viral infections, and it's caused by fluid building up behind the eardrum, so in the middle ear. And if it's sitting there for a long time, it can brew a bacteria causing the infection itself. In kids, you see it more often because the anatomy is actually slightly different than adults. So it's shorter and more horizontal, so it does not drain the fluid as well as it does once you're a little bit older.
And so how do you treat the ear infection?
Yes, so I would recommend being seen by a pediatrician who will look at the eardrum to see if there is inflammation or fluid sitting behind your child's ear. And they will also look for other related symptoms such as fevers and ear pain. So, depending on your child's symptoms and their age, they may recommend a period of observation or have you start an antibiotic.
So when should you go see a doctor about these illnesses? What are the big red flags?
Yeah, so the big red flags include fevers that are lasting more than 3 days. If your child is younger than 3 months, however, if they are running a fever, even a low grade of 100.4, it's a good idea to be seen by a physician. Ear pain, which can indicate an ear infection, any breathing difficulties, if you notice your baby is flaring their nostrils, trying to get air in, breathing faster than usual, any changes to the color of their skin, so a blue hue, which means that there is not as much oxygen flowing through the body. Those are all reasons to be seen right away.
Is there anything that you can do to help prevent your baby from getting sick? Or is this just basically part of being an infant because your immune system is not that strong?
Yeah, so there are steps that you can take to try to prevent infections, particularly in the newborn phase, trying to limit who comes into the household. So if anyone does have cold symptoms, asking them to hold off until their symptoms are resolved. And as guests come visit, ensuring that they're washing their hands very well as anyone in the home. And once your child is old enough, getting them vaccinated, as well as us as adults getting our vaccines updated helps provide that herd immunity. For younger ones, breastfeeding, if possible, that also provides a lot of great antibodies for your baby.
And then at what age should you start giving your young baby vaccines?
Yes, so you can start at 2 months of age for those routine vaccines.
Any final thoughts, doctor?
I think it can be very hard to decide as a parent if it's a good time to see the doctor. I would say you have very valuable information as a parent because you know your baby so well. If you feel like your baby is not acting themselves, or if you have any questions, please feel free to reach out to us. We are here to work with you to figure that out.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Of course. Thank you so much for having me.
If you want more information about common infant illnesses, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.